Okay, what is the most appropriate surgical procedure for this neonate? Pyloromyotomy, duodenostomy, lad procedure, ileostomy, endoscopic balloon dilatation. So I think another GI question. So 5-day-old neonate diagnosed with annular pancreas, scheduled for surgical repair. Has okay. So what's the surgical treatment for annular pancreas? So I don't think it's not pyloromyotomy. That's pyloric stenosis. A lat procedure, I think, is for malrotation, I believe. Ileostomy, no, you wouldn't give an ileostomy. Endoscopic balloon dilatation, no, I don't think that's right either. So I think I would do a duodenal. I've never heard of this procedure, but just out of
Okay, good. Okay, so
yeah.
talk to me. Okay, so I like how you work through this stuff. Talk to me kind of how did you choose? Okay, so a lot of my students have issues where it's like, okay, so how do you work through a question where I would say this is kind of next level, right? In a sense that it might be even a little bit too difficult even for step two. It's more like either a general surgery board question or a pediatric surgery board question. How do you work through this kind of question where some of these I mean, I remember when I was in your shoes, I'd be like, what the hell am I looking at? Right. So talk to me kind of how you work this, when you're looking at the answer choices and some of them, you're like, what the heck? Like, I don't remember this, what kind of question strategies are you using?
Yeah, I mean, I feel like this is like a simple question in that there's not really like critical thinking involved, right? They already give you the diagnosis.
Sure.
And then now I'm like, okay, I just have to use process of elimination and kind of give myself the best chance.
Yeah.
So I'm gonna rule out things that I know are not true. So
Okay.
that's how I went about it. Like I ruled out A, and then C, like I was like, I think it's for this thing, but I wasn't 100% sure. Ileostomy, like I've seen that be done. Like you wouldn't do that for an annular pancreas.
Sure.
And balloon dilatation, I was like, how would dilating anything, right? Even if it's like the esophagus, whatever, how would that help with an annular pancreas? You have to do some sort of more surgical management. So
Sure.
that's
Sure.
how I ruled that out.
Yeah, for sure. I think you worked through it pretty good. One of the things I would say add to your kind of thought process is you go back to the diagnosis as annular pancreas, right? So think about kind of the mechanism and what's the issue with annular pancreas, which is wrapping around the duodenum, right? That's the main issue. And if it's too tight, then you're going to have a lot of throwing up because you can't obviously process food past that stenotic standpoint. And so when I think about this, E can't be right because you can't just stick a balloon and dilate it because you have a fixed obstruction of the pancreas, literally choke holding your duodenum, right? And so that's not going to work. Ileostomy, right? That's too distal to the site of obstruction. And then pylomyotomy, that's going to be, even if you didn't know what that's for, you're like, oh, that's pylomyotomy, so cutting of the muscle of the pylorus, which is the stomach, not the duodenum. So then you get between B and C, right? B and C are going to be good, and then lab procedure, right? Malrotation, exactly kind of how you remember it. And lad is kind of one of the in the P's world, he's very very famous because of, if you remember, lad bands, right? So
Yeah.
yeah.